Thank you for a very enlightening first session and the beginning of the day. Moving on, extending a very warm welcome and a very good morning to all the esteemed delegates and faculties. We are happy to host the 9th Annual Conference of the Society of Heart Failure and Transplantation in Kolkata, the City of Joy. And we promise that the next couple of days will be an academic feast. Without an ado, we will move on. I would like to invite on stage to grace the chairs Dr. Julius Punen, sir, is President of the Society of Heart Failure and Transplant. Dr. Rajan, sir, is Secretary SHFT. Mr. Arnab Devgupta, COO of Manipal Hospital East Zone. Dr. Kunal Sarkar, Sir, Organizing Secretary of SHFT, and Dr. Debashish Das, Convener, Scientific Secretary. Thank you all. I would request Dr. Kunal Sarkar, sir, to address the audience.
Thank you ever so much. Friends, ladies and gentlemen, welcome to the city which a century ago discovered modern education in India and a century later is trying to take definite but bold steps in increasing spectrum of challenges like cardiovascular medicine and cardiovascular surgery. So all of you, welcome to this city of ours. We are extremely thankful to the Society of Heart Failure and Transplantation for considering Kolkata for the 9th meeting. Thank you for giving us the opportunity. We are a part of the country who are a little late, but we are catching up. If you consider that we are in India, which is currently performing this year in excess of 300,000 cardiac surgeries per year, we will this year in the East, the Eastern sector added together, will probably cross 40,000 heart surgeries, when at the bare minimum, we should be doing about double the number. The target for Eastern India as a pro rata basis of the Indian population should be at a bare minimum of 60 to 70,000 cardiac surgeries per year. And the signs are good, and we should be getting there within the next 2 to 3 years. Similarly, in the domain of heart transplantation, it is true that we took off a bit late, but I think the trajectory, the flight is in the right direction, and all of our units put together should have an aim of doing about something around 30 to 40 hearts a year, along with the cardiac devices, along with the advanced pacing systems. So the signs are good, we are moving in the right direction, and a very bipartisan approach of the government, the private sector added together, across all hospitals put together, we have to, our journey has to be defined by the objective that lies in front of us. This meeting was only made possible with the support of the industry. Personally, I'm very grateful to Manipal hospitals who've really gone beyond the usual roles of a sponsor to aid and assist us in making this conference possible. So may all of us have a good time. And if you have, and if you think that the academic program is very busy, the fault entirely lies with Debashish and Pradeep Narayan, who's got such a busy program going on that please remember, there isn't a lunch break as such, there will be a rolling lunch. So whenever you feel that you are threatened by hypoglycemia, do go out, have a bite, and come back. And once again, welcome to the city of ours. Let's all of us have a good time and go back both pleased and enlightened. Thank you for the opportunity. Thank you.
Thank you, Dr. Sarkar. Moving on, I would request Dr. Julius Punen to share his thoughts with us.
Good morning, everyone. It is really good to be in the city to be attending a heart failure program here, which I think is probably the first time we are doing it as a society. Last year when Dr. Kunal was asked if he could host the program here, he was quite happy to do so, and we took it as a theme to include more of people of this region as speakers and make the content relevant to this region so that it would benefit everyone from that. Thank you, Dr. Kunal, and thank you thank you to all the organizing team, Debashish, Pradeep, everyone, for making this a great program. Thank you.
Thank you, Dr. Punen. I would like to invite Dr. Rajan to share his thoughts with us.
Good morning, everyone. At the outset, I would like to thank Dr. Kunal Sarkar, Debashish Das, and Pradeep for taking such huge efforts to put up a very good program which is more informative and well organized. Congratulations to the team and of course to the Manipal Hospital which has helped them to do this thing. Cardiac transplant and lung transplant are like at a nascent stage where it is in patches in India doing well but not as a well organized work all over the country. I am sure meetings of this kind in areas where it is not taken up will facilitate the transplant work being done in a much improved and better way in India, all over India. I mean, wherever it is now lacking, people will take up the transplant work and heart failure work, which is really increasing its load in the Indian population. I am sure meetings of this will meet the need of those and fulfill the requirements for their treatment. Once again, I congratulate Shift as well as Kunal Sarkar team for doing this excellent work, and the next 2 days I am going to be sure it is going to be a feast. Like Kunal said, it is really packed program. It might tire a little bit, but I think you bear with that and you will go home with enough strong messages to take. Thank you.
Thank you, Dr. Rajan. I would like to invite Mr. Deb Gupta, sir, to speak a few words.
Thank you very much, sir. At the outset, I'd like to welcome everyone to Calcutta, the international guests, our national guests from all over the country. It's a privilege to have you here. For one, I started my career way back in the year 1999-2000, rolling in beds in one of the heart hospitals in Calcutta. That's Rabindranath Tagore. Had the opportunity to again roll in the beds in Bangalore at Narayana Hridayalaya, and have been rolling in beds at quite a few hospitals. From that point of view, heart hospitals and my history goes a long time, and such a great thing to see how Dr. Sarkar has been able to curate this and to enthuse the entire East Indian concept of cardiac surgeries and the entire cardiac programs in this part of the country. I was reading up a bit on what's happening in this transplant arena, and I'm so surprised to see that while the US does about 3,500 odd heart transplants, we do less than 10%, having 3 times larger population that we have. The numbers become even more skewed down to fractions as we go east from south and the rest of the country. So I think it's just about time that we put all our act together. Of course, there are lots of, while you clinicians are pushing the paradigm in terms of the boundaries of skills and how do you do it better, I think there is so much of work that also needs to be done in terms of how the ecosystem shapes in, how the collaborations come in together. And I think that's where organizations like Manipal, Narayana, Apollo, all of them need to collaborate together to bring this. It's no single person's mantle. It's not single individual institution's responsibility, but collectively all of us have a responsibility to take it further. I think I'll leave it to that, and we have clinicians from all walks of life. We would have management representatives from all walks of life. We should have government. I'm sure we'll have government representations as well. So together, if we see how the organ transplant thing can shape up better in our country, how we can push that boundary. We have Dr. Avnish Seth at the Manipal hospitals, who is very, very passionate about organ transplant. In fact, we're doing an international conference this year in Kolkata for the first time, and we are getting in quite a few international faculty who are going to come and share how they went about their organ transplant programs across the world. And we have learning stories from Tamil Nadu in our own country and Kerala's, where we can all learn and take it forward. Looking forward to it. Thank you very much.
Thank you all. Moving forward, it is a privilege on our part to honor some of the pioneers who made a difference in the realm of lung transplant.
You see, it's customary for every conference to identify VIPs into its inaugural session. So when we were putting our minds to it, that who would be the appropriate VIPs to inaugurate, to be a part of the inaugural session in a conference like this, it was foremost on our mind that every professional fraternity should choose for a VIP from within its ranks. All of you are VIPs, very important people. Our friends, our peers, our surgeons, our nurses, our physician assistants, our anesthetists. But amongst us, there has been people who've taken more load, who've shown a lot more initiative, and who has really pushed the boundaries of heart failure treatment and transplantation further. It's our pleasure to acknowledge a few of them whom we have with us today. It's a great personal joy and privilege to call a friend, a true leader in our specialty, who's not only a mercurial surgeon, but a great researcher, a great academic, and he is incessantly devoted himself to the area of innovation and coming up with devices so that our Indian devices and Indian technology in the very near future finds a place in heart failure management. Welcome to the city, my friend Dr. K.R. Balakrishnan. Can I request Dr. Julius Punan to hand over a very small token of appreciation to Dr. K.R. Balakrishnan, a person who revived the heart failure program in our country to what we know today. Bala, a few words.
This is unexpected. Thank you very much for this honor. The reason I really came was Dr. Kunal Sarkar had a chance to, I think a couple of months ago, visit my part-time job, apart from surgery, where we have a startup in IIT Research Park. We're trying to develop some devices, and he spent, I think, an entire afternoon. So we started this initiative, and I think I have a talk, so perhaps you'll learn more about what we're trying to do. It's a great time. I think these are exciting opportunities, and having had a chance to look at device development both overseas and India, I think there are a lot of positives, and I'm sure that in the coming decade, with a lot of young people around, we would actually be able to punch at least equal to our weight and more than our weight in the coming decade. Thank you.
Bala, thank you ever so much. Someone from our city, when we returned to the city to work from overseas about 3 decades back, we heard of a few people who were really working absolutely tirelessly to introduce modern interventional cardiology and modern cardiac treatment to our city. And one of the hallmark programs on which the fundamentals of cardiac treatment of Eastern India was based on was the cardiac program of SSKM Hospital and IPJMR. And for many, many years, a person who spearheaded the program and who led the program in ways more than one, our beloved and respected Professor Monotosh Paja. Monotosh Da, please. He's a true doyen of interventional cardiology in our city, and handing over a token to Dr. Paja will be our very own Dr. Dilip Kumar. Dilip, please.
Thank you, Dr. Kunal Sarkar and Dilip and the team to organize this very fantastic program of the Society for the Heart Failure and the Transplantation. I am very happy to be here by the cordial invitation, Dr. Kunal Sarkar. You can remember how the interventional cardiology developed in Eastern India as a whole India. I work in this Sheffield as well as the National Heart Hospital, then come back to December 84 with some reuse of the material, balloon, catheter, everything will come with the reused material and then sterilize. And we can remember that time, February, we have got the new cath lab in the SSKM hospital, the 85. Then we started the angioplasty, we used the reused catheter, which was collected by National Heart and Sheffield. I used to work in Sheffield Northern Hospital. Dr. D. Cumberland, he's a pioneer of the intervention in Britain. Then this is very useful. Then we started the intervention from SSKM 85. And simultaneously, my friend, Dr. Samuel Matthew also started the same work. And first PTCA registry meeting done at Hinduja Hospital that time. So it is of March, we also presented that time. And our data of intervention, so it first presented in the CSI December 85, the 15 cases only that time. So these very early. So after that, great improvement of the interventional cardiology as a whole, IVAS and these. But calcium was a very great problem. Now so many image technique and the IVAS as well OCT is very useful nowadays. And some IVL, shockwave and orbital, everything now available to tackle the situation of the complex PCI. So we are very proud of that. India was an important, largest number of cases than South Asia. I am proud of that, and therefore I congratulate all my colleagues, those who work in the intervention cardiology, enough improvement in intervention in India. So finally, I congratulate Dr. Kunal Sarkar and the team organized the meeting with the help of the particularly very useful Manipal Hospital. They are assisting us. Thank you very much indeed for inviting me in this occasion.
Monotosh Da, thank you. You've always been a pillar of support. So friends, those of you who are familiar with the history and story of heart transplantation, which in the annals of the history of medicine is a chapter in its own right. So we think of places like Cape Town, Groote Schuur Hospital, where it all started in 1967. We think of places like Stanford, which was one of the nurseries of heart transplantation. And whenever we think of heart transplantation, we think of one other center, and that is Harefield Hospital, London. Harefield is where many a battle has been won and lost, and the story of Harefield Hospital, where doyens like Professor Magdi Yaqub, Asghar Khagani, and the legacy of Magdi Yaqub and his work in Harefield Hospital as a great surgical and a great academic center still continues. And we are ever so happy to have the senior surgical faculty from Harefield amongst us. And we welcome Dr. Espith Cosbin, who's traveled only a few miles all the way from Harefield to be with us. And could I request Dr. Shankar from Manipal Hospitals, Bangalore, to give a token of appreciation. Nespit, please join us. I'm sure you're over your jet lag by this time.
Thank you very much, Dr. Kunal, and the organizing committee. It's an absolute honor to be here. And when I was asked to come over, a lot of my colleagues says, do you realize that you going to Kolkata is going to be monsoon season, and you're going to be soaked with rain. So I expected a lot of rain coming over here, but I have to say that since I've been here, I've been showered with friendship, with respect, and I've looked forward to continuing this in the future with my new friends here in Kolkata and in India. Well, thank you very much for having me here, and I'll be giving some talks a bit later. Thank you.
Thank you. Every story may have started far away, but it lands at our doorstep. And when the time reckoned that we in the city also took the first steps into this arena of heart transplantation, when many of us were putting our heads together, the person who really led the initiative from Kolkata and through whom we had the first heart transplant in the city a few years back, who's been a guide, a friend, a mentor from Fortis Hospitals, Kolkata, our dear own, who sings and operates with the same panache, our dear own Taposh Rai Chaudhuri, and Dr. Debashish Das will be presenting a token of appreciation. It is Taposh Da who kicked the ball first in this city, and we still look to him. Yesterday, when we had an oversubscribed wet lab, we were expecting 30 people, almost 70 turned up. Taposh Da donned the gloves, and he was there teaching the youngsters. Taposh Da, thank you.
I thank the society, not just for this honor, but because the way they have organized this conference is long overdue. However, I would dedicate this honor to the first few patients and their relatives way back in 1984 for trusting me to do the first bypass surgery of Kolkata. So that time only about a dozen or so bypass was done all over India, way back in 1984. Similarly, in 2018, when the patient came for, we got this recipient, and Bala was there to help us. And we have to convince, didn't have to convince the donor. They came from Bangalore, they're very willing, but this, the recipient, they have got a little their trepidations about what's going to happen. So we put forward Bala's name. He has got so many heart transplantations, we are in a safe hand, so we got through. But I think we learned a lesson, and most importantly, what pleased me, that from that particular 4 or 5 transplant onwards, all over the world, all over the city, it took off. It took off to Minalendu started doing, And then the government hospitals started doing. Plavon is there, he has started doing. SSKM, they have started doing. So in that case, it's expensive business. So when the government hospitals, they start doing in a regular basis, and I think they should start again, because most of the patients with terminal heart failure, they're very poor, and they cannot afford 20 lakhs or 25 lakhs asked for by the private hospitals. So I think I leave this to the doyens of government hospitals to take it more forward. Thank you.
Thank you very much. I think we have a really busy academic program ahead. Rituparna, we hand it over to you. Thank you for everybody.